Did you know that men who perform Kegel exercise regularly report lasting up to 3 times longer in bed and experience significantly longer erections? Yet most guys have never heard of these exercises, let alone know how to do them correctly. Today, I'm going to teach you exactly how to perform Kegels the right way, why they work so incredibly well, and the common mistakes that actually some people make that can make things worse. But before we dive in, let's get one thing straight. This isn't some ancient mystical technique or expensive supplement scam. Kegel exercises are scientifically proven methods to strengthen your pelvic floor muscles, the same muscles responsible for controlling your bladder, supporting your core, and yes, directly impacting your sexual performance. These exercises were originally developed by Dr. Arnold Kegel in the 1940s for women, but research shows that they're equally powerful for men. Hi, I'm Dr. Michael Gartner, double board certified plastic surgeon and physician. In this video, I will break down how men should do Kegels, the mistakes to avoid, the proven science behind them, and a step-by-step routine you can start today. So what are Kegels? Your pelvic floor is a sling of muscles stretching from the tailbone in the back to the pubic bone in the front. Think of it as a foundation of your core. These muscles support your bladder, prostate, control urination, and bowel movements. Fire during every orgasm and ejaculation. These muscles, when they're weak, men run into sufficient issues like urine leakage, post-void dribble, premature ejaculation, and erectile dysfunction. Kegels are simply controlled contractions of the pelvic floor muscles. You can think of them as push-ups for the muscle group that most men ignore. So why do men need them? Well, originally Kegels were developed in the 1940s for women after childbirth, but now we know men can benefit just as much. Why? Because as men age, or after procedures like prostate surgery, the pelvic floor naturally weakens. Add in factors like obesity, diabetes, or a sedentary lifestyle, and it accelerates. Let's talk evidence. In 2005, a trial on men with erectile dysfunction. 55 men were split into 2 groups. One got pelvic floor training, the other got lifestyle evidence. After 3 months, the exercise group showed significant improvements in erections. By 6 months, 40% regained normal function, a little less than half, just through pelvic floor training alone. After prostate surgery, men who trained their pelvic floor with a therapist regained bladder control faster and with fewer leaks than those who didn't. So the science is clear. If you do them properly, Kegels work. So here's the #1 mistake most men make. The most common mistake, squeezing the wrong muscles. Instead of targeting the pelvic floor, men clench their glutes, their abs, or their thighs. It's like trying to grow biceps by shrugging your shoulders. You work hard, but never get the results you want. Another mistake is holding their breath or straining. Kegels should be subtle, controlled, and isolated. So, how to find the right muscle? Here are a few ways to locate your pelvic floor. Stopping urine midstream. Only as a test, not a regular habit. That lifting sensation is your pelvic floor. Holding in gas. Imagine you're in an elevator and don't want to embarrass yourself. That gentle squeeze is the right motion. Visual cue. Picture your penis lifting slightly off a surface without touching it. That upward pull uses the pelvic floor. When you feel that subtle lift and tighten, you've found the right spot. So let's put it into practice. Start lying down with your knees bent. Keep other muscles relaxed. Breathe normally. Never hold your breath. Gently contract the pelvic floor as if stopping urine and holding in gas at the same time. Hold 2 seconds, then relax 2 seconds. Do 10 repetitions. That's 1 set. Start with 3 sets a day, morning, afternoon, and evening. As you progress, you can build to a 5-second hold with 5-second rests. Think of it as strength training plus agility training for your pelvic floor. Who should avoid Kegels? Well, Kegels aren't for everyone. If you have chronic pelvic pain, pain with orgasm, constipation, or constant urge to urinate, your pelvic floor might be overactive. Adding Kegels on top could make things worse. Building your program. Here's a simple way to get started. Week 1 through 2, do 10 reps, 3 times a day, and 2-second holds. Then with week 3 to 4, increase to 5-second holds. Add a quick flick. Then 5 to 6 weeks, 10-second holds, 3 sets daily. Week 7 and beyond, mix long holds and short flicks, performing in lying, sitting, and standing positions. Like you're going to the gym, progression is everything. Now, before we wrap it up, I want to make something clear. Pelvic floor exercises are powerful. They improve stamina, erection quality, and control, but sometimes exercises alone aren't enough. That's where modern medicine and treatments come in. There are several well-studied options that can be used alongside Kegels to get even better results. Sildenafil is a pill, one of the most time-tested medications for erectile dysfunctions. It works by increasing blood flow to the penis, helping you achieve and maintain firmer erections. It acts quickly and has decades of clinical data supporting its safety and effectiveness. Tadalafil, also known as the weekend pill. This treatment can last up to 36 hours. It's available as a daily option or as needed. Its long duration supports more natural, spontaneous intimacy without worrying about timing. Vardenafil, another effective choice, with a fast onset and known for fewer side effects in many men. It's ideal for those who want precise timing and reliable performance. So all of these options are available at drgartnerrx.com, where we provide safe, doctor-guided access to these medications. When combined with a consistent Kegel program, these treatments can be life-changing, addressing both the muscular side of erections and the vascular side, giving men the both of best worlds. In closing, here's the bottom line. Most men either ignore their pelvic floor or do Kegels wrong. But when you do them correctly, combine them with proven medical options when needed, you can dramatically improve erections, quality, longer lasting in bed, prevent urinary leaks, and regain confidence. This will help you in all your relationships. If you want to learn more or explore more treatment options, head to drgartnerrx.com. And if you found this video to be helpful, don't forget to subscribe. I post weekly science-backed content to help you control your health, performance, and longevity. Remember, most guys do Kegels wrong. Now you know the right way.